by NHS Test and Trace. The system, which has a budget of £12 billion, has its fair share of critics, and Sky News has learned it's being supported by consultants earning eye-watering fees. Some are being paid over £6,000 a day. Our economics editor, Ed Conway, reports.
As parts of the country go back into lockdown, questions are being asked about why Britain's test and trace system didn't prevent this second surge, and about why it's proving to be so expensive. Sky News can now reveal just how much the government is paying some of the private sector consultants it's engaged to help it. We've seen documents detailing the rates charged by executives from Boston Consulting Group, a leading management consultant working on the scheme. They show that the day rate, the chargeable amount each day for senior BCG consultants, is £7,360. BCG have applied a COVID discount of 10 to 15%. But even after this discount, these executives are being paid rates equivalent to a £1.5 million annual salary to work on test and trace. For those who have attempted to investigate the link between government and private sector consultants, it's deeply worrying.
I really am shocked. I mean, we've known that we've had an issue with a lot of expenditure on management consultants, but I didn't think that we'd be spending that much with such suboptimal results.
A Department of Health and Social Care spokesperson said, to build the largest diagnostic network in British history, it requires us to work with both public and private sector partners with the specialist skills and experience we need. Every pound is spent contributing towards our efforts to keep people safe as we ramp up testing capacity. It's hard to think of another part of the government's COVID strategy that is as crucial and controversial as test and trace. And these documents we've uncovered underline that controversy. For not only do they show the scale of the rewards given out to private sector consultants, they also show that far from scaling it down, they're planned to be scaled up, with hundreds more consultants taken on over the course of the next few weeks to work on the government's new moonshot testing programme. The Shadow Health Secretary vowed to raise the issue in Parliament.
These are staggering figures, and what they reveal is that the taxpayer is paying hand over fist huge amounts to these private firms, and we're getting a really poor quality return. We've got a testing system which fell over, and the government are just throwing money at private firms who are not delivering.
The app will help us safely live our lives.
Still, some argue that without management consultants, the government's programme would be facing even more trouble.
This has been a mammoth challenge for government. You know, if you look at within 3 weeks, they were able to set up the booking system for test and trace. So having to respond at speed and at pace and has required the government to bring in private sector expertise.
The selling point of Britain's testing system, budgeted to cost £12 billion, was that it would help prevent a second and third wave of the virus. With that ambition not having been met, many will wonder now whether that money, much of it going to the private sector, is money well spent. Ed Conway, Sky News.
The UK recorded 19,700